Hello everyone, this is Dr. Ridhima Gupta. I'm American board certified obstetrician and gynecologist. I'm currently practicing in Washington State. Today I'm discussing a very important topic, HPV. HPV stands for Human Papilloma Virus. There are currently more than 200 genotypes of HPV. Some are low-risk types, which causes genital warts. However, some are high-risk types, which can cause anogenital cancer or oropharyngeal cancers. Currently, in United States, about 79 million people are infected with HPV. Every year, there are 14 million newly diagnosed cases of HPV. HPV is the most common sexually transmitted disease worldwide. HPV is transmitted from an infected to an uninfected person through close contact such as occur at the time of sexual intercourse. Sexual activity, including oral, anal, or vaginal intercourse, can transmit HPV from the infected to the non-infected person. Most men and women who have ever been sexually active can get HPV at some point of their lives. Even if person delays sexual activity until their marriage or has only one sexual partner, they can still have HPV if their partner has been previously exposed. You can have HPV even it has been years since you were sexually active or if you do not have any sign and symptoms of HPV. The good news is that you don't get HPV by sharing toilets or by handshaking or hugging, sharing swimming pools, hot tubs or bathtubs, or by sharing utensils or food or clothes. Now, can HPV be prevented? Unfortunately, there is no sure way to prevent HPV infection. By limiting the number of sexual partners and by avoiding sexual intercourse with the people who have several other partners, you can decrease your chances of getting HPV. Condoms is a good way to protect against HPV. However, it does not completely eliminate your risk of getting HPV infection. HPV vaccines are a really good way to prevent HPV infection against certain type of HPV. Currently, only 9-valent vaccine is available in the United States. Please check out my video on HPV vaccination to know more about HPV vaccines. HPV testing can only be performed at the time of pap smear. Your doctor usually performs pap smear for cervical cancer screening. At that time, they utilize a cytobrush which can collect the cells from the cervix. That cells are sent for testing, and at that time, the HPV testing for high-risk HPV types can be performed, and those cells are collected at the time of cervical cancer screening. There is no test, unfortunately, in men to detect HPV infection. Now, coming to the treatment, there is no cure for HPV itself. However, the genital warts, which are caused by HPV, can be treated with medication or a small surgery. The cancer caused by HPV infection can be treated if detected in early stages with surgery or chemoradiation. Therefore, to conclude, HPV is a very common virus. Most men and women who have ever been sexually active are at risk of having HPV infection. The good news is that it gets cleared from your body with your immune system within 12 months. There is no cure for HPV itself. However, having HPV does not mean you are going to get cancer. HPV vaccine has shown promising results in prevention of HPV. Most cervical cancers are also prevented by regular screening. If you like my video, please hit the like button. Also, to keep getting the videos on women's education, please subscribe to my channel. Thank you for watching.